So welcome everyone to Addressing the COVID-19 Crisis, an open forum webinar series for pharmacy. And today we'll be talking about the impact of social media on vaccine confidence. My name is Sandra Leal and I'm the president of the American Pharmacists Association. So today's topic is one that's of special interest to me. We will be discussing the impact of social media on vaccine confidence and the strategy pharmacists can use to address misinformation about the COVID-19 vaccine. This webinar is funded in part by a cooperative agreement with the CDC. We have two wonderful speakers today, and I'm excited to introduce you to you. The first speaker that we have today is Judy Klein. And Judy Klein is the president and founder of Unity Consortium and has deep expertise in healthcare and vaccine. Judy's passion is supporting individuals to lead healthy lives by proactively focusing on preventative healthcare and immunizations. Towards this end, Judy actively engages with organizations that advance this approach, including the National HPV Roundtable Steering Committee and the National Adolescents and Youth Adult Health Information Center Advisory Committee. We also have with us Christina Kim. She is an oncology nurse practitioner at the Massachusetts General Hospital and a Team Halo guide with a following on TikTok of over 275,000. She carries a strong background in basic molecular and cell biology, as well as the care of acutely ill patients in a large academic medical center. She has a vested interest in ensuring her vulnerable patients are educated in the safety and efficacy of COVID-19 vaccinations. We also have our subject matter experts for Q&A. With us this morning, we have Dan Zlat. He's the Senior Vice President of Education and Business Development at the American Pharmacists Association, and he brings 10 years of experience at NIH as an oncology infectious disease specialist. We also have with us this morning Elisa Bernstein. She's a Senior Vice President of Pharmacy Practice and Government Affairs at APHA, and she brings 30 years of experience at the FDA. So we will point out the speaker's disclosure in this slide for a few seconds here. And then we have the learning objectives for you to review. Because this is a CE program, we will conduct some pre-assessment questions, and then we'll repeat them at the end of the broadcast. So the first question here is, what do people responsible for misinformation rely on? Great. All right, the second question that we have for you this day is the following. Based on the results from the Unity National Survey, most young adults receiving a COVID-19 vaccination are motivated by And the third question that we have today is, which of the following is considered best practice for combating misinformation on social media? Great, thank you for taking those survey questions, and we'll repeat them at the end. So a quick review of today's format. We have the introductions. In a few minutes, we will have Judy Klein and Christina Kim join us. And then at about 1:30, we will have open forum, a minute for your questions and thoughts. And then we will have a wrap up at 1:50 where we will review any of the upcoming items that are going on with APHA. So just a quick review of the ground rules. Please use a question field on the go-to toolbar to submit comments and questions related to the topic of discussion. I'm sure this is going to be a very lively topic with social media. We will try to get to as many questions and comments as possible. And there's a wonderful handout that's included in the toolbar for you to access today's slides and some additional links and resources that are provided. There is a number of different links and resources in that handout, so please download that for future reference. All right, and with that, I would like to invite Judy and Christina to turn on their cameras and join us for this morning's discussion. I keep saying morning, I apologize, I'm in the West Coast, but good afternoon. All right, well, thank you so much, Judy and Christina. Let's go ahead and get started. I wanted to start with just an introduction of the Unity Consortium and members, liaison and partners. And so Judy, I'll start with you. I wanted to see if you could talk to us briefly about the Unity Consortium and the work that you're doing to combat vaccine misinformation.
Thank you so much, Sandra, and thanks for having me and Unity present today, especially with Christina and yourself and the rest of the gang. It should be an exciting webinar for sure. So Unity Consortium is a nonprofit organization that unites diverse groups on the imperative to protect all adolescents and young adults against vaccine preventable diseases. And we focus on amplifying scientific and evidence-based messages in an engaging and catchy manner on social media, on digital media, as well as print media. And of course, we really integrate the voices of moms and teens and parents, I should say, via our advisory councils into all of our work. We share our messages through Unity channels, our website, or social media, as well as the channels of our members and our partners, as you see here, including associates like the Clinton Foundation, Univision, and of course, the American Pharmacists Association, who, by the way, is on our board of directors. So congratulations on that as well. And wherever possible, we amplify the voices of our young adults and our teens directly. For example, Ethan Lindenberger, Kelly Danielpour, Aaron Parsa are all members and vaccine advocates in their own right.
Wow, that's great. I'm so happy you have all these different partners to get the message out. That's great. The more good information out there, the better. So let's talk with you, Christina. Can you tell us a little bit about Team Halo and the work you're doing to combat vaccine misinformation?
Yeah, of course. I echo Judy's words of gratitude. Thanks so much for having us. It's really an honor and a real pleasure to be here. So I'll talk a little bit about Team Halo first. So Team Halo, excuse me, was started back in fall of 2020. It was a partnership between Purpose, the United Nations, and the Vaccine Confidence Project out of the London School of Hygiene and Tropical Medicine. It was developed as part of a larger COVID response lab that has been working to reduce the harm of COVID-19 through various campaigns and interventions to primarily provide fact-based information around the virus, preventative health measures in the vaccine, and of course to counter combat the wealth of misinformation that's out there. So what Team Halo does, it brings together an international group of medical providers, physicians, nurses, and scientists and pharmacists known as guides to create relatable, digestible, and engaging social media videos to build confidence, in particularly around the vaccines. So the primary platform that Team Halo uses is TikTok, but our guides use all sorts of social media platforms as well. At this point, we have about 100 guides with Team Halo internationally, and collectively we produced about thousands of videos and have garnered over 150 million organic views. So I started on Team Halo earlier this year when Team Halo was expanding their reach into the US. They really primarily were in Europe at the time, which was great timing because that's when the vaccine ramp up was really happening here in the US and of course around various parts of the world. And this was a time when I think the general population was really eager to get really good, valid, reliable information about the vaccine when there were so many questions about it. So it was a natural fit to join. So my followers on TikTok, as mentioned earlier, my followers numbers runs around 280,000, and looking at the demographics that TikTok provides for my followers, they're mostly female, about 3/4 female, predominantly based in the US, about 80% in the US, and they don't provide data stratified by age, but it seems like the vast majority of the folks that follow me are mostly kind of Gen X millennials, but there are definitely a large number of Gen Zs and young adults as well who follow along.
Wow, that's great. Well, count me as one of your followers. So I feel the demographic perfectly. Great. Well, this is amazing. Thank you for all the work that you've been doing on top of your patient care activities to combat misinformation. But Christina, you have a very important online presence. You have a number of followers, but not everybody uses their platform like you do. Can you talk a little bit about the misinformation that is being generated and how it's being spread?
Oh yeah, I mean, this could be hours long of a talk if we wanted to make it, but what we understand about misinformation, the original sources are often a little bit mysterious and unclear, but it seems like whenever we see viral dissemination of some sort of misinformation or false information, it always seems to start with a small handful of individuals or groups who will publish, say, an article, usually in a less than reputable journalistic site with journalistic integrity, or often a post on Twitter or other social media. And then somehow these get picked up and then shared and reshared and reshared, and they take on a life of their own. And what often happens is that the people that kind of initiate this misinformation really, in my opinion, rely on the assumption that the vast majority of their followers will not do due diligence to fact check or seek out the original sources to verify that information. I think what they rely on is that people may have a preconceived idea about, say, the vaccine, when they read something about it that reinforces that preconceived narrative or idea, it's instantly verified as truth for them. So much so that whatever instinct we would normally have to verify or fact check is just lost. And then there's this blind trust that's placed in a meme or just a headline. So I do believe that, the original sources of misinformation, I do believe there's some sort of ulterior motive there. But I don't believe that the vast majority of people who spread misinformation are doing this with nefarious intent. I do believe that people who spread misinformation from what they've heard or read are doing it because they themselves are victims of misinformation, and perhaps to some degree, a degree of scientific illiteracy. And frankly, I think that's what is being preyed upon and is being taken advantage of. And studies have shown that false news actually spreads faster than true news on social media. Studies have found that false news was more novel than true news, which suggests that people were more likely to share that novel information. False stories inspire things like fear, disgust, surprise, right? Whereas true stories seem to inspire things like anticipation, maybe sadness, maybe joy and trust. And contrary to what many of us might believe or what conventional belief might tell us, robots or bots are not really the accelerator of these sort of false stories. Studies have found that robots actually accelerate the spread of true and false stories at the same rate, which really implies that false news is spreading more than the true news because of humans, not robots, and are more likely to spread it. It's really, in my opinion, a secondary pandemic happening in parallel with the COVID-19 pandemic.
Wow, that's incredible. Yeah, I mean, I could see how quickly it is to share information to maybe something you thought was true, and you send it out and so many people see it immediately. And when you try to pull it back, it's hard to take it back. So no, thank you for that. That was really interesting about bots too. I wasn't aware of that. So Judy, tell us a little bit about your platforms and what do you do to find parents and teens? Which ones are they on the most? Which platforms do they use the most?
Yeah, first I just want to echo the last comment Christina made, because we had a mom advisory council meeting last night, and these are 9 individuals from all walks of life, all geographies, different backgrounds. And one of the women who has, I think 4 to 6 children, because they're always like running around in the background, said exactly what you just said, Christina, which is, I feel that this misinformation is spreading faster than COVID. And she used almost the exact same words. So it's a great analogy to think about as we're talking about mis and disinformation and the spread of it. So again, back to our mom advisors and our teen advisors, we are always asking them where they are and who they're listening to. And to your question, Sandra, for the most part, the parents are saying Facebook, to a little bit lesser extent, Twitter, and increasingly TikTok. Good news for Christina. And then our teens, TikTok, and of course, my young adults are always looking and sending me their videos. Instagram, Snapchat are the channels that they are mostly on. And then they do follow specific influencers, and they give us their names, and they also, especially the teens, let us know that they discount individuals who are sharing information like film actors, where they don't think those are credible sources. So that's good news as well.
That's interesting. Yeah, you know, there's a lot of people following, and I think we've had another webinar where they said most trusted individuals are, you know, healthcare providers, but actors are definitely not up there or high on that list. And can you tell us, Judy, a little bit about the Unity Consortium recent survey on parents and teens about the COVID-19 vaccine, some key takeaways on the surveys that you performed?
Absolutely. So Unity sponsored a national survey throughout the pandemic. We started last summer with wave 1, wave 2 was in February, and wave 3 was recently in June after adolescents became eligible for the COVID-19 vaccine. And we asked them about their beliefs and their behaviors around preventative health care, like well visits, routine immunizations, as well as their intent or their action around COVID-19 vaccines. And you could see here, and also in the side notes, more details about the survey methodology. But if we keep going on the slides, we'll see that one of the questions asks about the intent to vaccinate for parents who do not have their teens vaccinated yet. And so about 212 parents in the most recent June survey had not vaccinated their teens, and about a third of them said they did not plan to get vaccinated. And just to let you know, we looked at demographics as well, and more of those across the answers, more Black and Hispanic parents said they want to wait versus white parents. And then we also looked at where they lived, and about half as many rural parents versus suburban and urban said they would not plan on getting their teen vaccinated at all. So we did see plenty of demographic differences across these overall results that you see in front of you.
Wow. So can you describe some of the top concerns that parents and teens have about getting the COVID-19 vaccine?
Yeah, absolutely. So, you know, to the point of this discussion today, we've been asking about vaccine safety really starting in 2016 with a baseline study. And on this slide, you see parents and teens have only increased in their concern about vaccine safety. Parents are in blue, teens are in green, and this slide has their agreement with two statements. On the left, I have some concerns about the safety of vaccines, and you can see parents only were increasing in their agreement, with almost 2/3 of parents now saying they have some concern about the safety of vaccines. And you see similar trends with teens. And then on the statement, what I've read on social media has me concerned about the safety of vaccines. Again, even more dramatically, they're tying their concerns to what they're reading on social media. In 2016, about 45% of parents and teens said what they read on social media concerned them, and we're up to around 6 in 10 at this point. So again, yeah, that's real.
Wow.
Social media is impacting their beliefs.
Definitely.
And Sandra, were you, I think, also asking about, you know, what are their concerns specifically when it comes to COVID-19 vaccine?
Yep.
And what we see here, again, parents in blue on the left and teens in green on the right, is that vaccine safety is the #1 reason for not getting the COVID-19 vaccines. Either they're concerned about the possible side effects, and those could be, you know, ranging from the vaccine's not been out there enough for me to be comfortable with the amount of data that's available, or, you know, they're citing some of this really disinformation on crazy, scary, and bad side effects. And, you know, that's the #1 thing. At this point, we're also hearing vaccine efficacy concerns about, you know, the efficacy against the Delta variant. You know, it doesn't work anyway. Whereas we do know that the people who are hospitalized and dying from the Delta variant obviously are the ones who are unvaccinated. And then finally, we have the urgency issue with adolescents. And, in yellow, you see that they're saying, hey, not as relevant. COVID's not as relevant. They're not getting as sick. And, we know, again, that there are teens who are hospitalized and dying, especially, those who haven't been vaccinated. So those are the top reasons for not getting the COVID-19 vaccine.
And what are you seeing with regards to motivating vaccines or vaccinations in these groups? Are there things that you're identifying from your surveys?
Yeah, absolutely. So we also asked, why would you get the vaccine? What's going to motivate you? And I think, Sandra, you might have mentioned this earlier, and Christina as well. They want to protect themselves or their teens. That's their number one reason, as well as protecting their family. In listening to teens, they're very often concerned with their grandparents. And, they will get vaccinated if their grandparent says, you need to protect me, or they want to protect their grandparents. So they are altruistic from that perspective.
Well, that's good. We definitely need to protect our grandparents for sure. I appreciate that. So can you share any information about what role the pharmacists can play in influencing these demographics? I know this is a primarily pharmacy group that's attending this, and that any tips would be very helpful.
Yeah, I am a long-term supporter of pharmacists. I mean, for a long time, I realized that pharmacists are a trusted community healthcare provider and vaccinator. And, what this particular slide shows is that pharmacy is right up there, and in some cases a little bit ahead of where people are going to get their COVID-19 vaccine. So clearly they're very comfortable, they're going there. And we also know that parents want to hear from you. They want to hear from their pharmacist, who is, their trusted healthcare provider right in their community, someone that they have easy access to and go to often. And so you need to use your voice, use it often, use it broadly across your social media and your digital channels. And Christina, I know will back me up on this. Be personable, be engaging, share the facts in a simple, accessible, and authentic manner. Our moms just last night said that. They said, we want to hear from our healthcare provider, and we want them to simplify the message for us. And also, I'll say that, and I heard this again last night, in some areas, parents are being attacked for their decision to vaccinate their child against COVID-19. So you, as that community trusted healthcare provider, can, build their confidence, congratulate them on their wise decision to vaccinate, and take that positive action to keep their adolescents healthy.
Oh, thank you, Judy. I appreciate that. My presidential theme is be the voice. And so it really resonates just because that's what we have to do. Speak up and hopefully try to share the best information possible. So amplify that. Well, thank you for all of those great slides and that information today, for sharing today. And Christina, I'm going to ask you a few questions here. As a nurse practitioner, you've been very powerful as an influence through social media. So what are the common misconceptions that you're hearing, and how can social media be used to address them?
Right, yeah, so there are a plethora of topics, but many of them fall into kind of broad categories. And on this slide here are some of the more common themes that we hear that lead to hesitancy or misinformation. So fertility, this has been a big one even from early on when the vaccines first came out. Is the vaccine going to cause irregularities in menstruation? In my adolescent, is it going to delay her period or have it come too soon? Is it going to risk my young, adolescent's ability to get pregnant in the future? And there's a lot of misinformation out there about that, understandably with concern about the future. Similar to what Judy elicited in her surveys, that young people have strong immune systems. I don't need to get vaccinated. I'm strong. I can fight it. It's just like the flu. Kids can handle it. When we know that that isn't always the case, and that kids can be very vulnerable to the bad effects of COVID. Variants can be confusing for a lot of folks who are outside of sort of the scientific community and how they develop and what they mean. But a lot of folks, like Judy alluded to as well, think, oh, breakthrough cases are happening with the vaccines. That must mean they don't work, when we know that isn't the case and breakthrough infections are expected. And also this idea that vaccines may not be effective on all variants, when it's a lot more nuanced than that in a lot of ways. Testing is another big one too. The length of testing of the vaccines. They haven't been tested for long enough. mRNA technology is new. How can we trust something when it's only been around for a year or, or so? And then another common sort of a topic of misconception we hear is about natural immunity. So people think that either their natural immune system will fight off COVID adequately and protect them, or that if they had a prior COVID infection, that it's going to provide them with adequate sort of lifelong immunity. So these are sort of the common themes that we tend to hear. Many, many others, but these are some common ones.
Yeah, definitely. I've definitely heard the fertility one over and over, and we've had specific webinars just to address women's health issues, fertility, because that seems to keep coming back and maybe in even different ways every time. So you have to keep pressing on that one.
You do. And I also think that that topic is a very touchy topic. It's a very sensitive topic. And especially for a lot of women who aren't as vocal about their fertility struggles, and women who think about their children who are girls and who will want to maybe have kids in the future, there's this sort of instinct to protect, that ability to have children in the future. And I think it definitely carries a different weight than some of the other topics tend to, which is why I think it's a misconception that's been persistent throughout this entire vaccine campaign.
Yeah, and I remember, I mean, when HPV came out, there were concerns, and it's been historic. It hasn't necessarily just been as a result of this, but it keeps coming back up. Well, great. And did you want to share some of these comments?
So these are just, so some of these are some comments from some of my posts, and I thought I would just share them because some of them are a little bit funny and there is some humor to them, but I think they reflect themes. So the one from Redneck Ralph W, he says, calm down, it's got a 99% survival rating. My aunt got 2 shots and she got COVID 4 months later, so it doesn't work, right? So here, the misconception that the survival rate's so high, people are barely dying from it, but also vaccines don't work anyway, so what's the point, right? The one below it by Mary Roque 2020 talks about another misconception about testing, that the PCR test has been deemed to be ineffective or give false positive, and that there's no test for Delta. And then another misconception in there, which is accusing me of being paid. So although, as you mentioned earlier, healthcare providers are often viewed as trusted, there are also folks that are very skeptical of healthcare providers. What is our intention here? Are we getting paid by Big Pharma or some other entity? That's a common one that I get. And then the comment there in all caps, which says that, similar theme, that you're getting paid more to treat COVID patients. So, you basically kill them is what they're saying. They want you sick and not cured. It's sort of this idea that there's some other intent behind us spreading information about vaccines. There's some other intent, financial incentive, for example. They think that we are wanting people to get into hospital so we can get reimbursed. And then in the bottom right, that comment, which is common, which is, hey, this hasn't been tested for more than a year. I'm thinking 10 to 20 years of data. Maybe then I'll feel more comfortable. I'm wondering if this data is existing. And certainly, if we had the luxury of time, sure, we would gather years and years of data, but we don't have that luxury in the midst of a pandemic. So these are just some snippets of what we experience on social media for comments and common misperceptions.
Oh, they're great examples. I think I've seen all of these in some shape or form in my own social media. So I appreciate you sharing those examples. Well, I know that we're going to share a video of one of your TikTok videos, so I'm excited to see that. And hopefully people can also follow you and you can share your handle. But here is the video that we're going to be sharing. So we're going to go into that.
If you're one of the 15 million people in the US that has missed your second dose of a COVID-19 vaccine, you're going to want to hear this. So this isn't the first study to demonstrate this, but it just reinforces how important it is to get both doses of the vaccine. This is a study out of France that looked at how well convalescent sera, monoclonal antibody therapies, and vaccines were against the Delta variant in particular. Now, the key takeaway here is that in those individuals who had not had prior COVID-19 infection and had only received 1 dose of either Pfizer or AstraZeneca vaccines, that they barely induced a neutralizing antibody response to the Delta variant. But in those that were fully vaccinated, so a couple weeks after the second dose of the vaccine, those individuals generated high neutralization levels against not only Delta, but also Alpha and Beta. So if you're one of those people that for whatever reason has not received your second dose of the vaccine, please schedule it. Vaccination is the best way to protect you and the people around you and to prevent new concerning variants from popping up. It's the only way we're going to get through this pandemic.
That's great. Thanks for sharing that video. Can you talk a little bit about your process for creating this video and how do you pick the topics that you talk about? Oh, I think you're on mute there. It muted us.
Sorry about that. I muted myself there. Yeah, I think there's so much to say about how to create content that's effective. But a couple tips we can go over. So one, I think even though you're making, say, a video or a post, even though you're addressing, say, an audience, you want to think about, I am talking to a person. Think about how you would talk to any individual in your life about whatever topic you're discussing. So have open, direct, and personal communication with your audience. You really want to show yourself as a person, not just a provider, a scientist, a pharmacist. You want to demonstrate that although I am a pharmacist, I'm also a person that has really good, genuine intent here to try to help public health. You want to respond to real-time events, right? So whatever the hot topic is, and there's always a hot topic, whether it's in the news or spreading around social media, you want to do your best to kind of strike the iron when it's hot. And whenever a hot topic comes up, address it right there in the spot, because that's when people are going to be hungry for the information. You want to take people behind the scenes if you can. So that doesn't mean take your camera to the vaccine clinic you're working in or to the clinic you're in, but that just means give them a sense for what it's like working in a vaccine clinic, what it's like working in a pharmacy setting in the midst of a COVID-19 pandemic. Give people the sense that, this is what's happening behind the scenes when we on the front lines are really working the pandemic. As much as you can, there's so much sort of darkness out there and sort of a lot of negativity out there about the pandemic, but whatever we can do to promote hope and encourage positivity and optimism is really important to try to give that message in an honest way. Don't hide your humor. If you got a sense of humor and you wanted to be a stand-up comedian when you were, a teenager, let that come out. This is the time to be creative with that and to really attract and sort of grab those audience members as best you can with whatever sort of humor you can inject in there. You really want to help people see their culture and their language. So if, say, you're bilingual, you come from a specific background that is particularly disadvantaged in the sense of health equity and with regard to sort of distrust of the medical system, really sort of use that to your advantage to reach out to those communities that you yourself are connected to and that really are vulnerable and really could benefit from that familiar face and familiar language. And then as best you can, lean on other creators, lean on your fellow healthcare workers and scientists who are on social media to bounce off ideas off each other. And then leveraging popular trends is really important too. So if you scroll through TikTok and you see the same song or the same dance or the same theme popping up, take advantage of those and make a fun video related to COVID, related to that. And that can really grab people's attention as well. A couple other thoughts I had is, going back to sort of the comments about misinformation, I think it's really important to try hard not to demonize those who spread misinformation. And I'm guilty of this myself, totally admit that. It's easy to label these people as like having a lack of compassion, or how could they not care about their children and get their children vaccinated, or how could they not care about their own health? But we have to remember that they're just kind of regurgitating what they've been told and what they've been fed. Their narrative is shaped by the people around them, by people who are like-minded, which reinforces kind of whatever pre-existing beliefs they may have had. And this is a self-perpetuating cycle. So I always have to remind myself to resist feeding the trolls, so to speak, and to focus on educating, providing facts, and presenting data in as objective way as possible. It's really important also for us to acknowledge that the pandemic has been tough, right? Difficult, painful, confusing for a year and a half for people. People think we're getting mixed messages: wear a mask, don't wear a mask, get vaccinated, now the vaccines don't work, etc. And also, as we alluded to earlier, and especially due to the data that Judy presented about how out of the third of parents who don't want to vaccinate their children or aren't planning to, that a good chunk of them were from Black or Latino communities, from different socioeconomic backgrounds. And we have to remember historically that there are some communities who just have a deep and inherent distrust in the medical system. We have to acknowledge that and recognize that that may be the source of the hesitation and not necessarily political or other religious, for example, hesitations. And then another thing I just want to say with regard to social media, if you're not accustomed to being on camera or putting yourself out there, I think that's okay. And I think one thing to remember is that it doesn't matter the size of your audience or your following, even if you have 100 followers, 10 or 100,000. The thing to remember is that you're not just talking to your followers. You are talking to the entire community attached to that individual follower that's watching, right? So whenever I make videos, my goal is to equally try to reach those that are vaccine hesitant, those who are on the fence, and equally trying to reach those who maybe feel like they already know about the vaccine, they trust it, but they don't have the script or the verbiage to communicate with their family or their community when they're faced with topics about misinformation. So if you're making posts, just remember that don't be discouraged if you don't have a ton of followers. Remember that you are giving them the words and the data to use for them to take back to their own communities. And that's the beautiful ripple effect that we can have with these social media posts. So even if you don't have a following, remember that. And for any of you that want to get involved in Team Halo or on social media, again, what matters is that you're delivering fact-based, positive information with just one other person. That can make a huge difference. You don't have to be a guide with Halo that creates posts every day, right? You can take small steps like sharing content by other Team Halo guides, or signing up to Team Halo and then sharing updates. We can share updates with you, and you can share or remix. So there's a lot of different ways to get involved that can still have an impact, even if you don't have a huge following.
No, that's great. These are great tips and great best practices. I know probably some of the audience out there wants to know how to join Team Halo, so thank you for the information. And we already have some questions and comments coming in, so I definitely want to address both of those. But thank you both Christina and Judy for the information that you've been sharing. I just want to remind everybody that we have the handout that you can download, and there's even additional resources in that handout that we weren't able to get to today, but please download that handout. It's great, filled with great information. So what we're going to do now is address some of the comments, the questions, the feedback that we have. So if you can put some of the questions in that question bar there, we will get to them. And the first comment I just wanted to acknowledge here is the comment on the comments that you received, this individual saying they were wild. So I relate to them because I'm sure that they've seen similar things. But some of the questions coming up here, let's see, let's start with the first one. There was a question about, but maybe a comment that I'll start. The comment is, I see scientists and healthcare workers, including physicians, who are promoting anti-vax misinformation. One of them is Dr. Malone, who was involved in the development of the mRNA vaccine. I see this every day online, and he is saying very scary things, such as he is afraid of the antibody-dependent enhancement, ADEs, which is an issue with the mRNA vaccine. Any comments or response to that?
Oh yeah, I actually have a lot to say about that. So I think there's so much in that comment to kind of pull out. So one is, when we hear about Dr. Malone, one thing that I always try to convey in my videos is this is not me talking. This is not Christina Kim giving you this information. This is me speaking from the body of data, right? And for those of us that are science-minded and come from a background of science, we all understand and recognize, right, that this is not about one individual scientist's opinion. This is about trusting what the body of evidence has shown us, and that's how we practice our clinical practices, right? So I always caution folks from trusting one person who seems to be speaking a little bit against what the general consensus tends to be, scientific consensus is, and to just add a little bit of caution when you hear somebody quoting one particular person. And you're right, I hear so much about Robert Malone too, but with regard to antibody-dependent enhancement, this is the idea that somehow when you get a vaccine, that when you then get exposed to the pathogen, that you're going to basically encourage the pathogen to make you sicker. And we've seen this with the dengue vaccines, but that's really the only one we've seen it with. There has been zero evidence that any of the COVID-19 vaccines cause antibody-dependent enhancement. And if there was a suspicion, we would have seen that already because breakthrough infections are happening, right? And perhaps they're not happening a ton, but we know breakthrough infections are happening enough that we would have seen ADE happening if it was happening. There's no proposed biologic mechanism by which it could happen with the COVID-19 vaccines that we have right now. So unfortunately, there's a lot of fear around that claim, and there's no truth or data to substantiate it.
Yeah, and we have.
Sandra, I was going to add another example, not addressing the specific topic, but building on what Christina said about, healthcare providers, pharmacists, and physicians don't always have all of the right information. And I know that we talk a lot about them being the trusted source and things like that, but another example recently that has come up is the fact that the CDC recommended back in May that you can get routine immunizations as well as COVID-19 vaccines at the same time. We're still finding that healthcare providers, physicians, are either not aware of that or they're not willing to do that. So, it's just a note to say that look at some of those other sources, specifically on that particular topic that I think is really relevant to you as pharmacists, which is, feel free to quote the CDC and say, I can give you that HPV vaccine and that COVID-19 vaccine right now because you're missing both. And sometimes people are not aware of that.
Yeah, no, thank you, Judy. And I wanted to invite Dan Zlat, who is our expert here on vaccinations. And Dan, did you want to add any more information about this question related to mRNA? I know that that's coming up a lot here in the question and field here.
Yeah, absolutely. No, I think Christina did a great job of kind of covering the concept of, first off, ADEs. Very common question that we're getting with regard to mRNA specifically, and mRNA related to ADEs. There's not a lot of great evidence out there that suggests that there is the development of ADEs as a result of exposure to mRNA vaccines. Christina mentioned the dengue fever vaccine. There was also some ADE development in the really early measles vaccines and RSV vaccines. It's something that researchers are acutely aware of because of that experience, and it's one of the very first things that the FDA looks at when they're evaluating new vaccines. So we've learned from the experience that we've had over time, and because of that awareness, know that we are aware of that phenomenon, and it is absolutely one of the very first things that's looked at as vaccines are being developed.
And to add to that, Dan, is that it hasn't been demonstrated in real life data too, so early on when the vaccines were out, sure, perhaps we didn't have that actual clinical data to provide, but now we do, and it's clearly demonstrated that it isn't happening in the hundreds of millions of doses that we've given.
Well, good. Well, here's another comment, and this is a comment. I vaccinated individuals for the first 6 months of the pandemic during COVID-19 clinics. There were complaints from young females about alterations in their menstrual cycles. And could you address this? Because I think I've heard this one alongside with the fertility one quite a bit. So any information, Christina or Judy, around this topic?
Yeah, I mean, I'm sure, Judy, you probably hear this too, perhaps from either parents or from, young adolescent girls who are getting vaccinated. But, the idea is that the endometrial lining is just as much a part of our immune system as many other parts of our body. And, whenever we're in a stress situation or any other situation, like your body's fighting an illness, it's very common for a woman's menstrual cycle to be thrown off cycle. That's not an uncommon thing at all. And it's certainly not unexpected, I think, in this circumstance as well, when you're getting a vaccine and your immune system is getting revved up to develop antibodies and also a memory response from your B and T cells. I don't think that's unexpected at all. And I don't think that it's indicative of sort of a long-term problem. And even ACOG, the American College of Obstetrics and Gynecology, has been very clear that these vaccines are totally safe for women of childbearing age who are pregnant, breastfeeding, lactating to receive these vaccines. So I certainly trust that they have evaluated the evidence thoroughly to understand that it is safe, even if these menstrual irregularities do arise. They're considered to be temporary and not a sign of a permanent issue.
Thank you.
Great response, Christina. And I'll just also mention that I think, people look at overly are looking at the risks, and sometimes we need to state the risk-benefit ratio again to put it all in perspective, because it gets so blown out of perspective. The risks are up here and the benefits are down here, whereas it's like this.
Yeah, absolutely, for sure. And this is going to lead into this next comment here, comment question. It says, when trying to address misinformation on social media, there always seems to be that one person who responds with 10 comments to your one. And you can't possibly respond to every crazy thing they say. How do you address the information without getting into an argument in the comments?
Yeah, without getting into an argument or without staying up all night trying to answer every comment. I will say early on when I first started this and like following started to grow, I felt this obligation, this duty to respond to every comment and make sure that everyone was addressed and felt heard. And I quickly realized it's not feasible. It's not reasonable to do that. To some degree, it's if you start seeing themes of comments coming up, then maybe make one video post addressing that. But I think what's important to do is to try your best to weed out the people who seem genuinely interested in engaging in a dialogue, the people who are really interested and just need more information, versus the people who are really there literally just to bother you and just to get a rise out of you. And sometimes you can tell right away based on all caps or certain emojis or you can tell most of the time which are the comments that are simply not worth addressing. And frankly, a piece of advice that a lot of people would give is just block them, that those people are not worth having on your posts engaging harassing your followers, harassing other commenters, because simply they're not the kind of person you're trying to reach. You know, your goal is going to be to reach people who are on the fence, truly vaccine hesitant, or those again who just are seeking that the verbiage to use to bring to their communities. So bottom line is, it's not worth the time.
Very good. No, I appreciate that. I've seen, you know, people get back and forth in the comments. I'm like, oh, wow, it can go on for days, and sometimes you don't really get there. So that's great feedback to block them if you're seeing that they're just there to cause a fight. How about you, Judy? Any comments, anything that you're seeing, or any experiences that you want to share?
No, I think again, Christina responded terrific, and Sandra, that's exactly what we propose, which is don't get into a back and forth.
Yeah, absolutely.
It's really, amplifying their message versus yours.
Very good point. Absolutely. And it just, you know, you won't resolve it. I know that's just good social media guidance, you know, not to engage because it doesn't seem to go anywhere. So let's see, we have another comment question here. The anti-vax crowd seems to have a lot of spare time. How do you serve as a source of information without becoming a full-time job? And I don't know how you do it, Christina, balancing your actual, you know, day job, providing care, and then doing the work that you're doing on the side. That's incredible.
Yeah, I don't know either. I don't know. So it's the anti-vax crowd does seem to have a lot of spare time. They really do. But you know what they don't do is they don't spend their time actually reading papers, looking through methodologies, understanding kind of, you know, what journal is published in. They don't spend time doing that. But I think if any of you are going to choose to kind of go ahead and make a social media page about this, I think it's very important from day one to just recognize you need to have balance in everything, right? This is not real. It has real life implications, but social media is not real life, right? You have your job, you have your families to really focus your energies on. You know, I take frequent breaks. I just took a 3-week solid break off from all social media, and just to cleanse, you know, the toxicity, and it was great and helpful. But I think whatever we can do to find balance in our lives, I think in every aspect of our lives is really critical and important to spare yourself and your mental health.
Yeah, no, that's a good point. I know I try to be consistent, but no more than one post a day if possible, because it can overwhelm you. It can definitely become your full-time job if you let it. And let's see, another question here. Are either of you aware of any support from any agency in the U.S. administration to counter the misinformation on social media platforms using using those platforms like TikTok, YouTube, Snapchat, anything that you're tracking, anything that you're hearing?
I mean, Judy, go ahead.
No, I was just going to say, I mean, government agencies, you know, have also the risk of, you know, being attacked because of all the anti-government, you know, alignment with some of these anti-vax groups, as we've seen. So I think what the strategy that I'm aware of, and Sandra and Christina, you might be as well, is that they are looking to partners throughout the communities and nationally to do that work. And they're issuing a lot of information and data that we can use, but you know, the great thing is that they are, you know, supporting partnerships with professional associations and others to get the word out.
Well, I think this CE is an example of some of the partnerships to try to combat misinformation. So CDC helping us out here. And I will end with.
Is it okay if I just add a few more thoughts to that to continue what Judy was saying? I think it's also important because we need to balance that line between censorship of what people are wanting to express on a social media platform, and also what is truly considered a public health threat. And I think government entities getting involved is very tricky, like Judy alluded to. There's a lot of distrust in government as it is. There's a lot of thought that we're getting paid by government, you know, to spread information about the vaccines. I do know that from the Team Halo folks that there are sort of backstage channels, so to speak, with sort of higher ups in these various social media platforms to help address some of the blatant misinformation that's going on. So I know that there are some efforts there from the platforms themselves.
And we have a comment here. The White House hashtag Made to Save campaign utilizes influencers to interview Dr. Fauci as well. So some efforts there. So I know we have one more minute here before we go on to the next section here, but I definitely wanted to address this one. It said, please, please, please address a trifecta all over the internet that is being promoted by Dr. Dan Stock. He is the anti-vaxxer, and he's saying that we all need zinc, vitamin D, and ivermectin.
Oh, only 1 minute, Sandra, man. So yeah, I think we all know Dan Stock because he went viral at the school board meeting somewhere in the Midwest. He's a functional medicine doctor, and he was basically, promoting these other remedies. But the bottom line is, I'm speaking to an evidence-based crowd. We know there's no data to support the use of any of these medications to prevent or treat COVID-19. I think that's the bottom line there. There's just no data to support it.
Yeah, definitely. Well, thank you so much. And I'm actually going to hit a little bit of that in our next section, but I wanted to thank you, Judy. Thank you, Christina, for everything that you've been doing during this pandemic, for everything you do every day, and appreciate your time and your efforts to give us some great information, good tips, and really appreciate you being here today.
Thanks so
with
much.
that,
Thank you.
Thank you, and stay safe. So what we're going to do next is we're going to review the APHA's ongoing activities. So we'll start with the first item here, and the first item is a joint statement on ivermectin use. So last week, APHA, along with the American Medical Association and ASHP, issued a joint statement strongly opposing the ordering, prescribing, or dispensing of ivermectin to prevent or treat COVID-19 outside of clinical trials. And we know a lot of pharmacists have been dealing with this issue growing in the pharmacy of whether or not to dispense. So there has been growing use of ivermectin, but it is not authorized or approved for COVID-19. Hopefully this statement helps you with some of those decisions. The CDC and FDA issued advisories about it, and the NIH and WHO all state that there is insufficient evidence to support the use for COVID-19. And calls to the poison control centers and emergency rooms have been increasing following use. So we felt we needed to make a broad and bold statement for our members and the medical and pharmacist communities about ivermectin and its potential toxicities. Additionally, the FDA said in a recent tweet referring to ivermectin, which is often used in animals, "You are not a horse, you are not a cow. Serious, y'all, stop it." I thought that was very clever, and it definitely got a lot of traction out there. So hopefully you have had an opportunity to review this, but if not, it's in the handouts for you to take a look at that. So thank you. The next item that we have is that we are going to have a virtual congressional conference. So current APHA members are invited to attend an upcoming virtual congressional conference where you can meet with federal legislators via Zoom on October 5th. We will arrange for you to meet with your federal legislators, something that is significantly more impactful than emails and letters. On Sunday and Monday evenings prior to the day of your meeting, we'll ensure that you have the tools and the information to have meaningful, influential conversations. So if you have a desire or a passion for advocacy, to push for policies that would advance the pharmacy profession, please sign up. Registration is open only to current APHA members, and it closes tomorrow, Friday, September 10th. So if you're interested, please do it as soon as possible. It's really important to get in front of those lawmakers and advocate for the things that are important to you. So please check out the website listed on the screen to register. We also have some updated resources, the authority to immunize during COVID-19. So this resource is a comparison chart that outlines a requirement for pharmacists, technicians, and student pharmacist interns to provide COVID-19 influenza and childhood immunizations. It can be found in the Know the Facts Practice Resource Library, along with several other COVID-19 resources. And I want to remind everybody about the APHA Vaccine Confident microsite. We want to remind the audience that APHA maintains two fantastic information centers for pharmacists. The first one being our Vaccine Confident website, where you will find information about how to build confidence in COVID-19 vaccine. APHA Pharmacist's Guide to Coronavirus includes information on a variety of topics from testing to treatment to immunizing during COVID-19. And several opportunities to obtain CE are also available on this site, and there are several upcoming webinars that you can register for. I did mention some of the previous webinars on women's health and some of the others on specific populations to improve vaccine confidence. So those are great resources, so please take a look, sign up for them, and please review them. And these are a few of the education resources listed here. I also want to remind everybody that our next webinar will take place on September 23rd, and we will highlight the latest information on COVID-19 vaccine boosters and additional doses. Be sure to register today. Today's webinar recording will be available as soon as a home study, and it is really important to claim your CE before the end of the month. Check out the extra information in the handouts at the end of this presentation slide from the Unity Consortium and Purpose and Team Halo. There's a wonderful handout, extra resources available. Please download that before the session ends so that you have access to these incredible resources. And now what we'll do is we will get to the CE assessment questions and the claim code for your CE. So let's start with the questions. The first question is, what do the people responsible for misinformation rely on? And the correct answer is C, the assumption that their followers will not fact check information. Let's move on to the next question. Based on the results from the Unity National Survey, most young adults receiving a COVID-19 vaccine are motivated by? Yeah, the correct answer is a desire to protect themselves and their families, and as we talked about, protecting our grandparents. And the third question that we have is, which of the following is considered best practices for combating misinformation on social media? And the answer is correct. It's C. Show yourself as a person and not just as a provider. So that's great. Most of you got that correct. Thank you again for attending this session on a very interesting topic on social media. Thank you again, Judy and Christina, for your information. And again, thank you to the CDC for partnering with APHA on this programming. I hope you have a very good rest of your day.